Today is World Pneumonia Day, an annual event raising awareness about a disease that is both treatable and preventable, but one that remains a leading cause of death, especially among children and the elderly. With more on what you need to know about pneumonia, I want to bring in Dr. Marla Shapiro this morning. Good morning, Dr. Marla. Tell us more about pneumonia and what causes it.
So when we use that word pneumonia, it's a broad term that means an infection of the lungs. So with influenza, you can get a viral pneumonia. RSV, you can get an RSV pneumonia. But we're focusing on pneumococcal pneumonia, which is a bacterial pneumonia. And within that family of pneumococcal, there are many different serotypes. So that's what leads to it. And all these different strains behave differently. Some cause more severe disease than others. But these bacteria can spread really easily through mucus or saliva. And you can see these infections as a secondary complication. For example, if you get the flu and then you get a secondary bacterial pneumonia, you'll often hear about an older individual falling and getting a hip fracture and then getting a complication of bacterial pneumonia. So you're right, the very young and the elderly most at risk, but anybody who's got beyond that age, anything that impedes their immune system, so cochlear implants, a weakened immune system because of a disease or medication, any type of chronic organ disease, heart, lung, liver, chronic conditions like diabetes, particularly asthma, chronic obstructive lung disease, an individual who may be missing a spleen. So there are a lot of people who have a higher risk factor if they're confronted with that bacteria. And you said it's treatable, but what we're concerned about is we're beginning to see in some types of pneumococcal pneumonia bacterial resistance to microbials, in other words, antibiotic resistance. So prevention is really critical.
Okay, I want to get to that in a second, but I am wondering what it looks like in Canada right now with cases of pneumonia.
So if we look at the trends, and this is data from the Canadian Institute of Health that's looked at what happened in month by month, September, October, November of 2023 versus 24. And what you can see in emergency room visits across the board is anywhere between 120 to 132% increase in visits to emergency rooms. And that's very worrisome and possibly speaks to the fact that, again, as we've seen with other diseases, less uptake of the vaccines that are available to prevent pneumococcal pneumonia.
There are vaccines?
There are vaccines, and we've done a very good job in the kiddie population where these kids are vaccinated in the first year of life. They get two vaccines and then another one in the second year of life. But often what we're seeing in adults is the evolution of different types of serotypes. So we now have adult-specific vaccines that are available for individuals over the age of 50. Many provinces will cover it over the age of 65, but it's a conversation that you should have with your healthcare provider. Have I had a pneumonia vaccine? Are my pneumococcal vaccines up to date? What is my personal risk? Am I at risk for pneumonia? And sometimes age alone is the factor that can put you at increased risk.
Okay, I had no idea about that. So then lastly, in terms of treatment, what is available? How effective is it if you happen to get?
So it really depends if your pneumococcal strain is sensitive to an antibiotic, but we worry about invasive pneumococcal disease. So pneumococcal disease that's not only in your lung, but becomes blood-borne. So it becomes an emergency room visit, sometimes a hospital admission. Does have mortality associated with it. I think the message here on World Pneumonia Day is see if your pneumonia vaccines are up to date. If you're a child, if you're an adult, have that conversation with your healthcare provider.
Dr. Marla, thank you so much for this. Really appreciate it.